Hello, my name is Nikolai Yusupov. In this video, I would like to talk about Megacode Kali Advanced and essentially the basic features that it offers and how to easily connect it, sync it, and connect it to your monitor so you could run rhythms. So before I show you how to connect it, let me just go over the features that this mannequin has. So this is made by Laerdal. It's Megacode Kali Advanced. And for airway management, it can utilize the following tubes. It can use endotracheal tube size 7.5 or smaller. It can use laryngeal basque airway number 4, a combi tube, large adult or a trainer, and it can use a King LT number 4. So the reason why I inform of the airway stuff is that you may not want to use, let's say, 8.0 or 8.5 because you may not be able to facilitate easy entry of with the tube, and it can also damage the mannequin. In addition, the manufacturer recommends a catheter of 21 size gauge or smaller, and essentially the reason for that is that we can establish IV access on this arm here, and you see the tubing, right? And the smaller gauge will extend the life of the arm, so you don't have to make replacements, right, of these tubes that often. So this is very good to remember. 21 gauge or smaller size, or like 22, 24, will extend the length of the life. Also, right, there's a caution that this mannequin contains latex. One thing I want to preface before anything else, right, even though this mannequin is capable to perform all these procedures, you never want to use this mannequin as a test trainer. So what I mean by a test trainer is that when a student is just learning the procedure, let's say they're learning how to do IV access, you may not want to bring this mannequin out just to show a venipuncture procedure, because when they're still novice and they're still learning, they can cause a lot of damage to that particular arm. And this mannequin, will sustain that. The same thing if you're using this mannequin for just training, let's say, EMT students with BVM and OPA, right, insertion. The damage that this mannequin will sustain will be significant. So when do you want to employ this mannequin? Is ideally for scenarios when the test trainer skills have already been performed, they've been assessed by instructors, and they can perform them, right, basically with good proficiency. So you bring this out for a simulation type of scenarios, right? What else can this mannequin do? Right, so for the airway skills we see, right, it has obstructed airway. So how will we simulate that? So here on this mannequin, you notice, right, it has a couple of bulbs. So this one is for the sphygmomanometer. We're going to get to that in a little bit. And here you see 2 gauges, right? So what are these for? So one is for tongue. It says tongue on it. And the other one says for pneumo. So pneumothorax, right? And tongue is for, it will inflate the tongue to create obstructive airway. So just want to show you how this looks. So you find this bulb where it says tongue, close it. Same thing like the blood pressure cuff. And then what I'm going to do is, let me point the camera down, right, in the tongue. I'm going to go ahead and inflate, and you see, right, the tongue inflates. If I want to deflate, I basically release my valve, right, and you see the tongue, right, collapses. So one more time, close this up, inflate, right, the tongue inflates, release, right, the tongue deflates. And the same thing right here for the pneumothorax. This essentially can be used to perform needle decompression, right? So you pump this up, and inside, right, there's bulbs that will inflate the same way. They're replaceable, right? And you can deflate, right? So the same thing for the pneumothorax. It has both, right, the apical axis, and it has both, right, the thoracic axis. So what else does this mannequin offer us, right? So endotracheal intubation, right, and I'll show you that in a little bit. You want to use the lubricant that they provided, and you want to lubricate the passageways as well as the endotracheal tube very liberally. So let me show you the tube that you want to use. So here they say the training lubricant, right, and when we're going to, right, intubate this patient or perform any type of airway procedures, you want to basically coat both the tube, right, that you insert, and also the oral passages for this mannequin. They also recommend setting this mannequin upright after you spray the oral passages so that the lubricant makes its way down the passages, so it's easy entry when you're actually trying to instrument the airway with, let's say, endotracheal tube and so forth, right? What else can we perform? So the major things for us is obstructed airway, endotracheal intubation. We're also going to perform oral pharyngeal, right, airway insertion, nasopharyngeal airway insertion, which I'll show you, which is basically OPNPA. We're going to use BVM ventilation. What else? We're going to insert all types of, rescue devices, right? SGAs, supraglottic airways, such as laryngeal mask airway, right? We're going to use a combi tube. We're going to use a king tube. This mannequin also on the neck has a feature, right, for performing needle cricothyrotomy or surgical cricothyrotomy. It may not be the scope of a lot of EMS programs, but I'll show you, right? So at the neck, we have this thing that comes off, and we have spears. And here you have that membrane, right, that seals. You want to get a good seal here so there's no air leakage. But essentially, this is the point where you're going to be performing, right, needle cricothyrotomy or surgical cricothyrotomy. You definitely, right, have this over the neck. And then we basically, right, going to palpate the appropriate landmarks with the thyroid and cricoid cartilage with the cricothyroid membrane in between. So that's what's there for. We do have, right, if that membrane that I placed on the neck gets worn out, we have access where we're going to keep them, right, in the stock room. So this is would be the replacements, right, for that, right. So if they get damaged with all the needle sticks, we can replace them. So this is basically for the airway. Also, right, we can, when we intubate, we can auscultate the stomach sound. So if, let's say, the student incorrectly placed the tube in the esophagus, right, we can use the stethoscope, and you could auscultate the belly sounds, right? So we have the stethoscope here. Ideally, you want to have chest inflation, but if you hear positive, right, abdominal sounds, means that they placed the tube in properly, right? So this is the airway skills that this mannequin offers. Right, what else? So it has drug administration. So we have, first of all, right, IV insertion, which I showed you, right, was located on the right side with the tubing. We have the bag, right, that it comes with. So this is the bag we're going to employ in order to start. This is IO bag, and this is here to actually put some blood concentrate that we could mix. And we have the bags for the IV arm as well that we could cannulate in there, right? So we have IV insertion for both, right, antecubital fossa and the dorsum of the hand. And we also can perform subcutaneous and intramuscular injections. You actually note, right, they have pads here, right, for the injection sites, and they're replaceable. You have the deltoid area here, right? You have the antecubital fossa here. You have the intramuscular injections, right, intramuscular injections. And then the IV cannulation is here, and I'll show you the IO axis as well, right? So IV cannulation is on this arm, right? The tubing runs throughout, so you could cannulate, right, the entire arm here. This is, again, IM injection, right? And subcutaneous, you could inject in the belly. And here's the IO side, right, tibial IO. So this is, again, replaceable. You could drill if you have the easy IO gun, right, or you have the gem shearing needle. The students can be placed here. Again, we have these replacements, right, and this just goes over the leg, right? So that's for IV access points, right? IM and IO, right? So that's what this offers, right? In addition, we talked about tension pneumothorax, right? For decompression, we have bilateral mid-clavicular sites and we have mid-axillary on the right-hand side. So let me show you where they are, right? So here we actually, I'm gonna remove the top portion of this mannequin to show you the locations of them, right? So here you see, right, the bladders, right? So, and this one says pneumothorax, right? So if I close this down, and you see if I'm inflating them, you see how they expand, right? And when I deflate, right, they go down. So there will be a positive confirmation, right, upon the expansion, and the student, when they essentially perform needle decompression, they'll hear, right, the sound and the air escaping. And over here, we said, right, there is decompression as well, right? So on the right side, we have another decompression point, right? It's an alternate site that they can, right, again. And your control is pretty much here, right? So put this back, right? And again, your deltoid for IM injection, right? So I deflated. This is, again, the ports where you would cannulate. So a little tip for this, right? So you bring the bag, right, with imitation blood, and then the other bag, right, where you have essentially the collection bag. So the blood that's being infused, you want to hang it higher, and the collection bag is going to be on the floor, on the ground floor, right? So make sure it's tightly closed. You want to open and fully flush, right, both of these tubes so that the collection bag gets, right, some of the blood. And once the collection bag gets some of the blood, you want to kind of close down the collection bag, right, a little bit to generate the backflow, back pressure. The top bag is going to be open, and the bottom bag, you're going to close it somewhat, so that when the student is inserting IV under the gravity pressure, he'll get flashback, right? And then as the time passes by, the bottom bag will get filled up because the fluid will be going in. You just replace them. You put the bag that was hanging on the top on the floor, right, and the bag that was on the floor hanging on the top, to again regenerate that pressure so that they see that positive flashback. Right. Another important feature on this mannequin, just while I'm here, you see these are the points for attachment of your ECG monitor. I'll show you how we do this in a little bit. And this is where you place your pads for the defibrillation points. I think it's very important to tell you is this, right? You don't want to put the sticky pads on this mannequin. Why? Because this becomes sticky, and then it attracts all the dirt, right? So you may not want to put that here, right? So just utilize what the manufacturer recommends, and they recommend that you employ these pads here, right? So let me put this to show you, right? So this goes firmly, right? Snaps on. Must have this positive contact, right, for that, right, that feel. And then for the EKG that I have here, right? So the snaps, right? If you remember, salt, pepper, ketchup, right? So this is salt, right? Pepper, and get ketchup. Why don't we have, right, the green, the relish, that's usually connected on the toe lead, right, which I have here, but for this purposes, we don't need it to run the Philips MRX, right? So salt is white, pepper, black, red, ketchup. And then you have your defibrillation or electrical therapy pads here, right? Do not put any adhesives to the chest. All right. Okay. What's next for this mannequin? So chest tube insertion is located on the left-hand side. So the chest tube insertion will be here. Usually in the paramedic program, we don't perform chest tube entry, but this would be the point, right, where you would perform that procedure. So chest tube insertion, and we definitely have the advanced Megacode, Kelly here, right? What else? So we have cardiac skills. So first of all, we definitely have the 3 to 4 lead ECG cables. I just placed them on, right? You saw me do it. We're gonna run the rhythms. I'll show you how to connect this in a bit. We have pacing capability with variable threshold, and you control this via the Simpad, which is charging over there. And then we could actually perform defibrillation up to 360 joules. If you're using a monophasic unit, here we have a biphasic unit, and this unit goes up to 200 joules. This mannequin is able to accommodate, right, real threshold. So you can defibrillate this mannequin at 200 max joules. You could defibrillate this mannequin at 360. However, you must be cognizant that nobody's in contact with the mannequin, because they do say, right, death can result and you may get electrocuted, right? So electricity conducts, so you definitely want to stay clear when you're defibrillating this mannequin. What else? We have circulatory skills. So this does have a palpable pulse. It has a bilateral carotid pulse. So you could palpate the pulses here. I'll turn it on in a bit and I'll show you. It also measures non-invasive blood pressure, right? So here you have the blood pressure cuff. It's a specialized blood pressure cuff. Not every blood pressure cuff can be used here. So I'll show you how you connect it. So essentially, you put the cuff, just like a normal cuff, around the arm. And you notice there's this tubing that's coming out of the mannequin, right? So what's going to happen with this tubing is this is the specialized tubing that's now found on your specialized blood pressure cuff, right? And you're going to connect it essentially to the mannequin, and you're going to be able to control specific blood pressures, right, on the Simpad. So this connects like so. Make sure you have a good connection, right? So this is for your blood pressure. This is how you are going to essentially pump this up, right? Your dial, right, is going to be connected to the arm. so that you can clearly see it. And then you want to take special caution, right, not to damage this cuff. Why? Because it's specialized equipment, right, and you cannot just use any cuff that you're going to, insert. Where are you listening? So you're listening, placing your stethoscope over here. So when you're training the students, they're essentially going to put, right, the diaphragm, right, in the antecubital fossa when they pump up this cuff, right? And this is the control thread, right? And I'll show you essentially how it runs. Just be cognizant that this tubing is connected, and then you're going to set specific numbers on the Simpad, which I'll show you in a little bit. Right, so we went over that. The next thing that I want to show you, also, right, they have both brachial and radial pulses. How do you feel them? You see these indents here. When the mannequin is running, you place your fingers here, and whatever rhythm is showing, so let's say it's sinus tachycardia at a rate of 140, right? You will be able to feel the pulse at this rate, right? So you have, right, your pulses, your brachial side, and you have your radial side on this mannequin, right? And you basically just press in, and you will feel the pulsations. So we went over that, auscultation of the blood pressure. What else? So yeah, it definitely has all types of lung sounds. So you're able to hear all types of lung sounds. I'll actually play it. If you turn the volume up enough, it's going to be very audible. You have wheezes, you have crackles, everything, right? Bronchi. You have bowel sounds, you have heart sounds, and they're synchronized with the ECG. So the students can basically come in with a stethoscope and assess for the scenario specifics. You don't have to say, okay, you hear wheezing or you hear crackles. You'll say basically, listen, right, to your patient and tell me, what you hear, right? And that's essentially what you will pre-program on the Simpad. It has vocal sounds, so it's not many, but you could say yes, no, scream, right, stuff like that. We are able to have live voice through the microphone, right? So they did include the microphone here, which we can essentially hook up, right? And you can essentially converse. I find that probably maybe a little bit cumbersome, and just as the instructor, you can just state what the patient is saying, right? Perhaps not use the microphone for that. Right, so this is the capabilities of that, and what else I want to emphasize? So I already said, right, for airway management, we said we use a 7.5 on the tracheal tube, number 4 LMA, right, and you want to pre-lubricate everything in order to provide good entry. So first, let me show you how to connect it all, and then we'll go through some of the skills so you see how it's done. So first thing I do, right, ideally this mannequin, we would like to be dedicated on the stretcher, so you don't want to lug it around and break, components of it. So bring the stretcher along with you to whatever room you are designated. Everything is going to be basically zipped up in this pouch, right? So you unzip and everything should be here. What you're going to see inside, right, is going to be this Simpad that I've been charging, but once it's charged up with this cable, you have enough battery life. And it's going to be in this pouch right here, right? The Simpad Plus. And you're also going to have the SIM box that's also going to be here. So what I would like to do first is make sure, right, it's strapped up to the leg so it's not mobile. And there's also a battery unit. So what that means is that here I have it plugged into the AC outlet, but you could disconnect it. And as long as this battery is charged, right, it could be mobile. So you could create a scenario, move this, for example, to the lunchroom and say, you have, a patient collapsed, right? Somebody collapsed in the lunchroom. We need your help. And so the students can gather their bag and come and assist. So you will basically disconnect this, make sure this is connected to the leg. Now, on the mannequin, you have the following, right, connections. So be very careful that you don't damage these pins when you are inserting it. So this will say this side up, right? So what I do is I align the pins, right? And I gently, right, push it forward. And then I make sure, right, I screw this in so that it doesn't pop out during the scenario, right? I want to make sure it's secure. So this is secure. Connect this pneumatic cable to it, right? Right, and I hear the snap. And this portion here, this is essentially your battery, right? So battery can be in the back, and it's going to be running, right, or charging in this case right now. So now this is for my AC wall outlet, and you see a couple of ports here. So I want to go through what they are. So connected to the power, and the first thing I want to do is I want to turn on, right, this unit, right? So the reason why I want to turn on this unit is that then we turn on the box, and this will facilitate linkage, right? How do I know it's on, right? So how do I know it's on? When it's on, I should hear the mannequin cough, right? And then this will be the second part to be turned on, right? So I see the light is green, right? But my Wi-Fi, so it means I haven't paired, right? You see it's also green. So green means I have not paired it yet, right? So now I turn on my box. How do I know it's on? You see the green light turning on. Also, very important, right? Make sure the Simpad does not leave this mannequin. We have other ones, and this is basically designated to this particular mannequin. So try to have everything together, right? So this is on, and what it's going to do is going to connect it wirelessly via Wi-Fi. Now, if you, for some reason, you're having issues with the connection, they did provide Ethernet cables, right? Here, well, I'll show you in a moment. So now you're at this screen, right? So you can click System Settings, right? And then you want to see, right, where's the simulator. So we have the Megacode Kali Advanced, right? And, right, we are connected. How do I know I'm connected, right? I see it's on my screen, and I also see that I have a blue light. So blue light means I have connected. If you did not have the blue light, you were not connected. What you can do is you could connect your Ethernet cable. I have two here. So one port goes here, and the other port will go here, right? And the moment you made that connection, right, you will see, right, that it will connect on the screen. But for now, we're going to use the Wi-Fi since I connected it. So now I'm going to go back, and then I'm going to run right in the manual mode. So I run the manual mode, it will start up, and it will give you a preset scenario here, for example, healthy person, that's fine, right? And once it's on, right, we should be able to see the rhythms on our monitor, which we already connected here, and we should be able to hear long sounds and everything like that. Right, so I think what happened is, because I connected the cable, it disconnected. So let me go back and reconnect it, right, Megacode Advanced. And then manual mode. Healthy. Okay. So now we're back in session, right, blue light. And now let me turn on some long sounds, right? So long sounds, we said we can do some wheezing. So you click wheezing, and then let me make them very audible, right? So I put 10, activate, and let me make the respiratory rate 28. So I think you'll be able to hear that, right? So at the bottom, you see all the controls. So the long sounds is this feature, right? The rate you are able to have a slider, right, to activate. And then for your long sounds, right, you could adjust the volume, right? So let me put some coarse crackles. The reason I put 10 is that so it's audible so you guys can hear. But for the students, if they're using the stethoscope, what you can do is maybe reduce it down to like 5. Right? So reduce it to 5 so they're able to listen with the stethoscope. Here we have the pacing threshold, right? So it has 80 up to 200 milliamps. That's basically when you get captured, right? So do you want to get captured 20, 70, 80, right? So let's say I want to keep it at 80 milliamps, right? It also has the heart sounds, right? So for example, we can do aortic stenosis, right? So it's faint, but I could hear it. But with the stethoscope, they certainly will be able to do it, right? So heart sounds, you have friction rubs, murmurs, and so forth, right? And then we also have the blood pressure, right? So here is where the manual blood pressure will be. I'll show you how to use it. So here, let's say we put 180 over 90 for this case. Right, 180 over 90, we activate it, right? And then also, right, you have the cord cough sounds, right? So you could increase or decrease when the student is auscultating, right, and they hear it, right? So once we had preset all this, how would the student auscultate the blood pressure? They would essentially have the blood pressure connected like we had so. You would not be able to hear it, but the students will essentially use their stethoscope. They will place this, right, on the antecubital fossa, and then very important that they use the appropriate, right, bulb, because we have two other ones here, right? So the right one will be with the red tag. They're going to pump this up, right, and then slowly deflate, right? And on the stethoscope, they will definitely be able to hear, right, audible cord cough sounds, and that would be the blood pressure that you had preset on the screen that I just showed you, right? So that would be for your blood pressure management, right? So let me go back. So we talked about that. We have abdominal sounds, right? So we could have hypoactive, right, hyperactive, and essentially, I remember going through this in my nursing school, right, when we were hearing all these adventitious sounds, right, and you are always taught, right, you first auscultate before you palpate. So you auscultate first, then you palpate, and then so you could also increase the range, so a 10, right? Let me come to the side, maybe we'll be able to hear it, right? Yeah, so you could hear the abdominal sounds as well. So you could adjust it, right? So I'm going to put no sound. Now, I talked about patient speaks. There's not that much, right? Let me make it, make it 8, so it's not very loud. He could cough, right? He can moan, vomit, shortness of breath, right? Scream. Students always get kicked out of this one, and yes and no, right? So some of the basic things, right? So we go back. So this was our sounds, right? Here you could adjust the level, so they'll show you, right, where exactly you're listening to heart sounds, lung sounds, left and right. You could adjust your belly sounds, cord cough sounds, right? How you say the microphone essentially, and what you hear, right? So directly on the Simpad, right? And this is basically the actions, right? We perform the blood pressure. Now, in terms of your rhythm, so let me go through the cardiac stuff. So the monitor is attached. It can perform all electrical therapies, right? So you will attach your monitor for the time being so that you can see it. I'm just going to bring this table over here. And right, lay this down flat. So my monitor is already pre-connected. My monitor is already pre-connected to the patient. All I'm going to do is turn this on. Right. So here, right, we will see what we have displayed. Right. So we have sinus rhythm. So let me see all the rhythms. Right. So here you see sinus rhythm, atrial tachycardia, SVT, junctional rhythms, and so forth. So let me put AFib just for an example, right? So AFib, you see, can range from 50, right, heart rate of 50, all the way to 240, right? So let's say I put a heart rate of 50 over the AFib. I click activate, and what do we see on the screen, right? So the screen changes to atrial fibrillation, right? We're going to see heart rate come down, right? I'm just going to say volume, right? Right, you're able to print the rhythm. It will certainly display it, whatever you see on the Simpad, and it comes out, right? Now, remember we said our threshold of pacing was 80, right? So this was our threshold. So now, right, as you know, right, AFib, that patient is symptomatic heart rate of 50, right, or maybe 40, right, may need to get electrical pacing, not cardioversion, right? So let's go back, and then we'll see how this works. So let's say we put a heart rate of 50, and the patient was symptomatic, right, and we wanted to pace. So we set a pacer, right? So let's say pacer rate is 70, and we're going to initiate start pacing, and then I'm going to increase my pacer output, right? We set capture at 80. So let's see, let me go to 80, right? Acknowledge, right? So now you see, right, the moment your heart rate dips below that number, right, though we said 70, the pacer is initiated and kicks in. It was reading the rhythm, right, to find the appropriate R waves. So once it has established the R waves, right, you see the pacemaker, right, working properly, right? Now, let's say on this monitor, right, we exceed the heart rate of 70. We go 90, it will turn off automatically, right, because we are on demand mode, right? Demand mode will sense the patient is higher than normal and will increase the rate, right? And so the pacemaker, even though everything is on, there's no capture, right? And again, right, the moment I decrease my heart rate to 50, right, you'll see again pacemaker will kick in and will start pacing automatically, right, in demand mode. So AFib, like I said, is one of those rhythms where you could have a patient who is unstable with very slow heart rate, and you can perform, pacing. And then when the heart rate is exceeding, right, let's say 200, right, patient symptomatic, you can perform synchronized cardioversion, and I'll show you how that looks, right? So we decrease the heart rate. The moment the machine learns, right, the heart rate has dipped, it will resume pacing on its own. So right now it doesn't read the heart rate, so that's why you don't see the pacemaker initiating. Right. So the moment it picks up, I want to just see how it will turn on. It takes a little bit to read, right? So here it's 104, but watch, right? It will dip down, and then why do you see these alternations, right? Is because from R to R, right, the intervals varied, right? So since the intervals varied, right, you will have this issue going on. Right. See if it will pick up. If not, it might take just a little bit longer for the machine to learn the rhythm. Usually we have the pulse ox also on the patient, so the other factor will also be displayed. The other thing you could do is you could cycle through the leads to find the appropriate R wave, right? So you could go through your leads to find the appropriate R waves where they're maybe a little bit better, right? Maybe lead 2 probably be ideal in this case, right? So yeah, so it's having issues, right, detecting the appropriate heart rate. So it's thinking it's 141. Right. So now you see, right, once it finally got the appropriate heart rate and it's triggered the pacemaker. So essentially that's what I wanted to show you, right? That you need to be able to adjust this. And I like this AFib because you could go from pacing, right, to normal heart rate to synchronized cardioversion, so the students understand. So let's say I set the heart rate at 200. So I set the heart rate at 200, make it 205, right? Pacemaker will obviously turn off, right? Well, let's say if you were teaching students about synchronized cardioversion, right? So let me silence it, alarm's off. We're going to press sync button. You see sync is on, right? We are going to exit out the pacemaker screen. Say we start with 100 joules, right? And we're able to charge, right? Everyone's clear, and you're able to, right, perform synchronized cardioversion. This monitor, right, if we put, let's say, ventricular fibrillation, you're able to defibrillate at max joules, right? Just make sure nobody's touching the patient when you're performing this procedure, right? Everyone's clear, right? And this is how you would do it. Can this do a 12 lead? No, because this mannequin doesn't have the precordial lead. So if I were to go back to my monitor setting, right, and I were to say 12 lead, right, you're going to see all the leads because you are unable to basically have a connection here, right? There's no chest leads that you connect. So 12 lead, you could either have a printout for the students, right, that you show them, but you will not be able to display the 12 lead here. So back to the monitor mode, let me exit out the 12 lead, right? So different rhythms, right? And in addition to this, right, if you see there's a plus sign, right? So let's say if I had, let's say, sinus rhythm going, right, activate, and I wanted to add, right? So what can I add? So here you see, right, the moment I press plus sign, right, you see additional rhythms come up. So we have Wolf, Parkinson's, White, hyperkalemia, ischemia, right, all other stuff, left bundle, right bundle, right. And in addition to that, if I wanted to have like some sort of ectopy, right, so extra systoles. So what this is like PAC, PJC, PVC, right? So let's say we do PVC unifocal and we want the pretty frequent. And the moment I activate this, you will see the PVC start to pop up. Your monitor will start to alarm, right? So this is a good thing to, occasionally do in your scenarios, right, for the students, right? So you'll see the PVCs coming up. What else you can adjust? You can adjust the respiratory rate here, right, as the students auscultate. In addition to, right, blood pressure, we talked about temperature and pulse oximeter reading, right, that you can adjust. So where this comes up, right, if we had the screen, right, Laerdal also makes a screen where vitals can be displayed. So this is where you would be adjusting all your parameters, right, your temperature, if you wanted for that to pop up, right, if you wanted for pulse ox to come up, all right, and so forth. So here you have all this thing. For what we are going to be performing, you're probably going to be using quite often the cardiac stuff. So, right, ventricular tachycardia, right? So here you would basically use the slider. What I like about this Simpad, you're not like preset like with all the other rhythm generators. So if you put VTAC, you may be at a rate of 200 or 220, whatever the preset rhythm is. But here you notice the rate of 220, right? So this could be true ventricular tachycardia, as opposed to you could give a scenario where you have a patient who has end-stage renal failure, they miss dialysis, and you could activate heart rate of 120, right? And you see VTAC, right? So VTAC 120 may be trying to see if students will assess for hyperkalemia in that setting, right? Maybe not a true VTAC, electrolyte abnormality. So it's another good thing to have a sliding thing that can basically have a preset rate, or you have a case, right, in PALS or ACLS where there's a specific heart rate. So you don't have to guess, you just preset the rate, and students are able to execute that, right? So I'll show you what else we got before I go to the airway. So this was the Simpad. If the battery, right, it's 100%, if you wanted to charge it, you basically bring your charger, right, and you connect it like so, right, and that's it, right? You will see, right, that it's charging now, right? I usually just have it connected to the charger when I run my scenarios. Let me just go over what other features it got before I get to the airway. All right, so I already spoke about, lubrication of the airway. We talked about, right, having, let me move the cruiser. All right, so we talked about moving inflating the tongue, right? So we had the tongue inflation that basically was for the obstructed airway, right? I'll show you that again. We also talked about tension pneumothorax, right, to tighten up the knob and then perform needle decompression. Again, this is not to be used as a test trainer, as in when the students are learning that needle decompression procedure. It's ideally to be used in a scenario setting. So let's say if you're doing PHTLS and you have a scenario there, right? And students already did all the trauma skills beforehand, that's when you want to utilize this mannequin, right? So tension pneumothorax. Here is basically the steps of how to connect it. So I went through, right? What you want to do is, the first thing you want to connect the Megacode Cali, right, to the Simpad, right? You connect this, and then this turns on second, right? So this is first, and this is second, and you want to see the blue light come on. Here shows you a connection of your blood pressure cuff, right? And then we already spoke about, right, using a 21 gauge or smaller, so essentially they mean like 22, 24, right? So that you don't cause too much damage to the arm, right? Less exchanges of the tubing, right? And then we already spoke about, right, you can use 360, but make sure, right, on the dual setting, make sure you stay clear, because if you come in contact, you will be shocked. Here they advise, right, to use all safety precautions per the monitor and the manufacturer, right? And whenever you're performing electrical therapy, especially defibrillation, pacing, and also, synchronized cardioversion, make sure, right, it says measures could result in injury or death to the operators or students, right? So make sure you staying clear. right? So this were the major stuff. I just want to show you the airway control. Let me move this out of the way. So move this table out of the way. So for the airway, right, we said we want to be very liberal with our lubrication techniques, right? So here I usually have the mannequin align, ear hole to the sternal notch. Let me just show you again, right? For the inflation of the tongue. So this was the pneumothorax, right? And this was your tongue inflation. So if you look inside the mouth and right, so you see how the tongue expands and deflates. So you could also mimic, right, edema, angioedema from this case, right? Let me show you the lubricant, right, and how to utilize it. So ideally, you don't want to spray in the patient's face or nearby, because this will contaminate, right, the mannequin. So here I have actually have a empty box that I'm going to employ. So I already have the two pre-molded, right? I have my syringe connected, and I have some airway stuff that I'm going to basically put here, and I want to coat it, right? So I'm going to spray, right? So tip of the tube. And then here we have our nasal trumpets. Right? And what they recommend is, right, you want to spray, right, and then you want to sit them up, right, so they will kind of coat the air passages, right, and this is going to be employed for the airway management. So once we have that lubricant, right, here I'm going to show you, right, so it definitely can accommodate nasal trumpets, right, so here I have the nasal trumpet entry. So you always want to provide slight traction. Good. And then, right, cross finger technique, you can employ the OPA, MPA. Once these are in, you will see some chest rise on this mannequin. Right, so I have the BVM. So you see chest inflation, right? So even though I'm using one-handed technique, which is not the best technique, actually the worst technique, right? You could still see positive elevation of the chest. See, this is, yeah. Ideally, right, we want to teach the students to do the two-handed lift the mandible, right, technique. So I'll put the BVM here because I'm going to employ it once. You'll see for the intubation. Hopefully it's clear, right? But for airway management, you want to lift the mandible open, right? The triple airway maneuver. So we pre-oxygenated the patient. I'm going to remove my nasal trumpets, OPA, MPA, right? I'm going to put it here. Here I have a 7.5, right? Remember, the manufacturer says a 7.5 tube, so I have a 7.5. I have my laryngoscope, right? And I'm going to see, right, how the intubation looks. Just need a syringe. Here we go. So ideally, I have my partner holding it, right? But I just want to see, right, how you instrument the airway. So we already put some lubricant in the airway, and then let's see if it will capture on the video, right? So as you slowly inch, right, you see the uvula, and then past the uvula, right, I'm looking for epiglottis to sit it in the vallecular space. I don't know if you're able to visualize. I mean, I'm able to see it pretty well, but it's a little bit harder on the video probably. Yeah, on the video it's probably harder to visualize. So instrumenting the airway, very clear-cut vocal cords. Right, insert my tube. And then I want to see, right, for the chest expansion towards the feet. Right, and then if I was successful with intubation, right, we see positive chest rise. Right, so that is all very well. Right, so we could auscultate bilateral breath sounds, right? We can auscultate negative epigastric sounds. So it's definitely, you can intubate, right? I'm just gonna let go of this to show you, right? So I want to intubate the stomach, and I want to see, right, the difference. So what happens if I actually put this tube in the stomach? How will that look, right? So deflate. And let's see how it looks if I'm in the stomach. So put this in the stomach, inflate my cuff. And so, yeah, sure enough, right, the stomach inflates. It almost felt unnatural putting it in the stomach, to be honest with you, right? But you see, right, inflation of the stomach, and it's very visual, right? You could feel it, right? It's inflating. And if the students auscultate, they'll say, okay, positive abdominal sounds, right? Epigastric sounds, negative bilateral lung sounds. So you definitely misplaced your tube. You're not going to see any endotracheal ETCO2 here, right? So definitely you could intubate the stomach, and you see that here, right? So I showed you all the airway stuff. Intramuscular stuff is here, right? IV stuff is here. All the connections. We're going to keep all the pads together, right? So they're in one place. This even has scrubs that you can place on the mannequin. There's a shirt and there's pants, so that and they have zippers, right? So if you wanted to mimic like a real patient where they respond to a call and they have to unzip and check and assess, listen to the lung sounds and so forth, this can do everything, right? This can also has a feature, right? You could actually even put an adapter to do a Foley catheter, right? But Foley catheters are not really in the scope of EMS paramedics, right? If this was a nursing program, they could place a Foley catheter here. So this was basically an overview of this mannequin, what it does, how to turn it on, how to run your rhythms. So hopefully you found this video useful, right? And please take care of this mannequin because a lot of students will be employing this from many programs, right? It could be EMT, paramedic programs, primarily paramedic programs, to run their scenarios, right? And not to be employed for task trainer tasks.